month. I am pleased to have you join us for the second sub-working group meeting for Working Group 2.2. I want to just provide a few administrative announcements before we get started. Beginning this month in November through February, we're going to be looking at specific initiatives available to us through international organization partners. We will also be exploring new activities or new policies that we can initiate. And in January and February, we will have a full menu of activities available for review, and we will be inviting you to express your interest to the international organizations directly and other partners that are managing these respective initiatives. Some other administrative announcements. Please update your screen name so it lists your name, organization, and country. We will soon be launching the Coalition website. It's taken a bit longer than expected, but we are going to be launching it in the next few days, so please be on the lookout for an email. We will be doing a lot of our Coalition work on the website in between the meetings, so we will keep adding functionality as we go through the weeks and months. Thank you also for your feedback regarding the number of calendar invites that we've been sending. We recognize that we have been sending many calendar invites to participants, so for future meetings, we're going to send one calendar invite for the entire block of 4-hour meetings for sub-working group 1.1 through 2.2, and another calendar invite for the 3-hour block of meetings for 3.1 to 3.3 if you signed up for public health meetings. And we're going to send the invites for both East and West. So this should cut down some of the meeting invites, but please note that if it's the 2.2 session that you're interested in, that you would then look at that 4-hour block, understanding that the last hour is the one for the 2.2 session, since they run concurrently one after the other. We're also continuing to seek coalition participation to include stakeholders from all target audiences of synthetic drug issues in your governments. For example, chemists, policymakers, justice representatives, etc. Please continue to share the coalition registration links with your colleagues so we can make sure that all stakeholders have a seat at the table. I'm going to ask Sarah from my team to paste the agenda for this session in the chat so you could see the agenda for today's meeting. And now I'd like to turn it over to our two co-chairs for today's meeting to call on presenters, share thoughts, and moderate the discussion. Those are Jenny Fagua and Claire Amal. Over to you all. Thank you so much. Goodbye.
So welcome everybody, and as Brian says, I think today is a really good opportunity to hear testimonials and initiatives from a range of different countries and regions, and we have quite a packed agenda with several of those. So I won't take up too much time, but if Jenny, if you had anything you wanted to add before we hand over to Dr. Olubusayo Akinola for their presentation.
Hola, cordial saludo. El día de hoy me encuentro reemplazando.
Hello, everyone. Warm greetings to you all. I'm representing Jenny Fagua. She's on vacation. My name is Diego Sanchez from the Ministry of Justice from Colombia. My warm greetings to you all. We can see that our agenda is quite complete today, so we'll be following every activity, and we can recognize our first speaker if there isn't any question.
Okay, hello everyone, good afternoon. I think I can continue. Thank you.
Please do, yes, thank you.
Okay, thank you, good morning, good afternoon, depending on the part of the world that we have. My name is Olubusayo Akinola from the African Union Commission, and I'll be making a brief presentation on the Pan-African Epidemiology Network on drug use. So I want to talk briefly about the overall objective of the African Union Plan of Action, which is currently being implemented 2019 to 2025. And the overall objective is to improve the health, security, and socio-economic well-being of the people of Africa by addressing drug trafficking and problematic drug use. The plan of action for the African Union is anchored on 9 policy pillars, and it follows a multi-sectoral, balanced, and integrated approach to drug control. The African Union Plan of Action, Policy Pillar 1, talks on measures to address drug demand reduction and health issues associated with drug use. So the policy pillars E and F, we have objective E9, which talks about measures to strengthen national epidemiology surveillance on drug use, production, and trafficking. And objective F1 talks about measures to strengthen reporting mechanisms for the identification of new psychoactive substances and on the consequences of their use, their possible sources of production and distribution. And therefore, the Pan-African Epidemiology Network on Drug Use that I'll be talking about today is anchored on these policy pillars. So the Pan-African Epidemiology Network is aimed at improving the information base for policymakers to address generally the socioeconomic consequences of substance use, and also forms a process whereby we establish local sentinel surveillance networks in all the African Union member states. And the PAENDU helps us to assess the regional and national responses, interventions on drug control. It further supports the member states to regularly report on the drug situation as required by the African Union Plan of Action on Drug Control, and further assist to generate strategic information for policy decision making. The PAENDU project, for the PAENDU project, which has been sponsored by the USINL, and we are indeed very grateful for this support. We have national focal points that are nominated through the request from the African Union Commission to member states. So we forward, the African Union Commission forwards note verbal, a well-detailed concept note and terms of reference to member states through the diplomatic channel. And then we have 2 technical experts from ministries, government agencies responsible for drug demand and supply reduction. We go through this diplomatic channel to ensure that countries take ownership of any data that emanates from their country. The PAENDU report, just to give us the reporting system, and we have 2 types of reports that emanates from the PAENDU. We have the extent of drug supply. And for the extent of drug supply, we use the quantities of drugs that has been seized and the number of drug seizure cases as proxy indicators of trends and patterns of drug supply on the continent. Just to give a brief overview of the report and what we have, the trend analysis based on the last report that was just launched last week in Zambia. We have more than 500,000 of individuals that were arrested in Africa for drug-related offenses from 2016 to 2021. And 1 in 10 persons arrested for these drug-related offenses is a woman, and less than 0.1% were children. Furthermore, a cumulative total of over 200,000 tons of drugs were reportedly seized in Africa. And overall, cannabis, we have about 51.1% because cannabis still remains the production, the manufacture, the sale, even for personal use, still remains illegal in Africa. And then we have Captagon, which is a synthetic amphetamine type stimulant that was scheduled in 1986. This slide just shows us the type of other drugs that were being seized, and also the cannabis seizure, the trend, where we had over 42,000 tons that were seized during the COVID-19 lockdown. And then we have the quantities of drugs seized in kilogram by the left. So the second aspect of the PAENDU report, this is the report emanating from this network, also talks about drug demand reduction. And then with this drug demand reduction captures the number of individuals that assess treatment. So they presented themselves for treatment and rehabilitation services in the hospital. And this demand, although it's very limited, but we use the demand for treatment as also a proxy indicator to monitor the extent and patterns of drug use on the continent. And I'll just be talking about 3 variables. We have several variables on the PAENDU questionnaire. And then the first one that is very important is just the age disaggregated data. that talks about the number of the age groups of individuals that access treatment. And we can see in Africa, from 10 years to 65 years, accessed treatment from 2016 to 2021. Furthermore, it would interest to also note that 4.21% of individuals that were treated for substance use disorders were aged 10 to 14 years. And these are classified as children and young teens, implying that we have early initiation of substance use in some settings. We also have gender disaggregated data, and the data reflected that 1 of the 8 persons that access treatment for cannabis use and heroin use disorder is a woman, and 1 of 3 persons that access treatment for disorders related to the non-medical use of pharmaceutical is a woman. And then this is my second to the last slide, which talks about sources of referral to SUD treatment. Just to mention that people in treatment were most often referred by friends and family. However, we had an increase in the number of people that were referred to treatment from the judiciary from 2018 to 2021, increasing to about 75%. And it shows that many countries now refer people into treatment and diversion away from criminal sanctions, and also that our advocacy and sensitization on alternative to incarceration is also yielding a fruitful result. And the policy implication for the PINDU itself is that the networks helps us in general to scale up evidence-based substance use prevention, treatment, care, and rehabilitation and social integration policy framework to effectively address substance use related disorders on the continent. And finally, it helps us to strengthen the capacity for effective intra and interagency collaboration and cooperation to disrupt illicit drug trafficking networks and related organized crime on the continent. Thank you.
Thank you very much, Dr. Olubusayo.
Thank you. Okay, so my presentation will be brief. I understand we have time constraints, and I'll be speaking on best practices and models for national drug observatories, focusing on some of the tools that we support in our member states. So just very quickly, because I know a lot of you do not know who I am or what the Organization of American States is. The Organization of American States is a sub-regional agency. We focus on the countries of the Americas, and most of our technical support that I'm talking about today is for the countries of Latin America and the Caribbean, supported by our member states in Canada and the United States as well. The OAS, or the Inter-American Drug Abuse Control Commission at the OAS, is the forum for member states to discuss and find solutions to the drug problem and provide them with technical assistance to counter that problem. And the Inter-American Observatory on Drugs, where I am the chief, is the research and analysis section at CCAD. And I'll be focusing on some of the tools that we have and that we are using in our member states that might be useful models for others in the world. So the first question, why a National Drug Observatory? And I hope that many of you were able to be at the previous session that talked about data collection tools, but your National Drug Observatory, and you might use another term, you might use research and analysis section, but these are built as a response, and it's work we've done in Latin America and the Caribbean for many, many years to help member states, because there is a fundamental need for monitoring drug trends over time. We need to build a body of evidence and a knowledge base in order to support public policy. And most of our national drug observatories are required to inform at both the national and international levels when it comes to issues on drug supply and demand. There are many international conventions, international data collection systems like the ARQ from the UNODC. In our region, you have one called the Multilateral Evaluation Mechanism, or the MEM, and there are others as well. And so countries need to be able to respond in a rational way based on clear scientific evidence on what is occurring in the drug problem, both at the national level and the international level. And just again, clarifying what is then the National Drug Observatory. That is the body that carries out national level research and analysis to ensure that your decision makers, that your policy makers, have the appropriate information they need to make policy choices based on sound scientific evidence. I'm going to focus on two key tools that we use with our national drug observatories that we find are particularly relevant when it comes to gathering evidence, and especially in the context that we're seeing, this very changing context of synthetic drugs. And those are our drug information networks and early warning systems, which I will get to in just a moment. But first, how do we operate in terms of projects and how our projects built? I did not want to go through each and every one of our projects because that would take far too much time. But every project that we have in our member states includes some of these basic elements. The first one is that we provide technical support to our national drug observatories. In the case of the Inter-American Observatory on Drugs, the national drug observatories are our direct counterpart at the government in each country, usually located at the National Drug Commission. To do that, we spend a lot of time focusing on building a drug information network to support long-term monitoring of the drug problem, and early warning systems to provide instruments for rapid response. In order to do that, though, we spend also many, many years with many of our countries building drug epidemiology, that is in order to monitor trends that allows us to report at the hemispheric and regional levels. It also provides us with standardized information across countries on drug consumption, helping our countries build their systems for gathering treatment data, supply control indicators, and also to be able to report to the early warning system of the Americas. That is our sub-regional early warning system. And finally, in order to do all of that, we have a lot of training and capacity building that we do with the countries in order to build all of these networks, and also to help them convert their scientific data into policy, into programs, and into relevant interventions. Now, the work that we do at CCAD, at the Inter-American Drug Abuse Control Commission, again, that is for our member states. The models might be useful in other regions of the world, but for similar support, you might look to the UNODC. In fact, we have, and my colleague Martin Reifel-Huber, who presented in the previous session, mentioned, we have a long-term collaboration with UNODC, especially on data collection and on the early warning systems programs. There are other sub-regional agencies. We just heard from one in Africa, in Europe, and there are others. So those are places you might look to for similar support for what we do. And then to focus on the two main tools that we see as relevant for the discussion of the global coalition. The first one, and one of the first things that we do when we support a country that is building or trying to strengthen their national drug observatory, is help them build a national drug information system. And this is to be very clear, the focus, the objective of your drug information system or your DIN is on the long-term monitoring of drug trends at the national level. This is so that when you implement a policy in 2023, 5 years or 10 years down the line, you can say, what was the long-term impact of that policy? How do you do that? Your drug information network would triangulate information from multiple sources to develop a complete picture. So the example that I have here is that you would ideally be collecting information from your National Ministry on Health, from your drug treatment services. Emergency rooms would be very important in here, your prevention programs and the type of information they provide. Universities or other research institutes that carry out your scientific data collection on drug supply or on drug demand. There are aggregate data from areas such as your police, from perhaps your military, customs, forensic laboratories. The REDLA members that we have mentioned here, that's an academic network, an international academic network that we manage from CCAD. So the idea would be that you would be triangulating information from many sources, but this is aimed at your long-term analysis and helping you to evaluate the impact of your policy over time. The other tool, though, that we've been focusing on more and more are the national early warning systems. So when we began the work of building drug information networks more than at this point about 20 years ago, we were always thinking about the long term. What is the long-term impact of your cannabis legislation or your supply-based policy interventions? But what we're finding more and more in the context of appearing synthetic drugs is that we're having more situations where there are very sudden and very acute situations that might come and go rapidly, but require immediate intervention. And that's the purpose of your early warning system. The objective here is to gather and analyze information on sudden changes in drug use, or could be trafficking, or other patterns that are indicating emerging threats. And this is done using targeted information sources. So not all of your long-term monitoring would take place here, even if the information eventually makes it to your monitoring network. What you want to be able to build with your early warning system is to allow rapid responses to acute situations that threaten public health. So your national observatory would be involved in this. They would normally be coordinating this. One of the key players in this would be your national laboratories, because these are the laboratories that are detecting the composition of the drugs that are in the market. Law enforcement has a big role on this side. Emergency services, if you have local early warning systems or local systems that report rapidly, that would be part of your early warning system. And obviously, and I think Martin mentioned this also, my colleague from UNODC, the importance of, to use the term, a technical table or a review committee, because the information that you're getting from your early warning system is less likely to be your rigorous scientific data. Rather, this is emerging data from targeted sources that you may not have the long-term scientific quality on. You would need a technical review committee to determine whether or not this is a real threat. So what we're trying to build with the countries that we're working with in the hemisphere is their ability to monitor on the long term, but still respond in the short term. And just from the little bit that I've showed you, some of your information sources might actually be the same. It's really a question of what is your objective? Is it long term or is it short term? How are you going to use that information? And how should you be thinking about using it for your different objectives? So in terms of our programming and how we've been approaching the countries that we're working with in this context that's changing very quickly when it comes to synthetic drugs, is focusing on strengthening our national drug observatories, recognizing their essential functions, which are to collect data, monitor at the national level, analyze and interpret that information in the long term in order to evaluate policy, but also be able to provide information that allows us to respond to what's happening day to day. And the two key tools that we focus on for that at the National Drug Observatories are our drug information networks and our early warning systems. And again, often similar, even overlapping. You might build one on top of the other, but with different objectives and with different goals over the long term. Your long-term monitoring analysis and your rapid data collection for quick responses to acute situations. So I hope that, that this fulfilled what they were asking me to do at the presentation. And I'd like to thank you very much for your attention. And of course, you can reach out to me. My email is here as well. If you have in-depth questions, I'm happy to respond to any questions afterwards as well. Thank you.
Thank you very much. And thank you, Bill. Nice to see you. And good afternoon, good morning, and good evening for wherever you may be. You pardon me that I want to switch off my video. I will be giving a testimony on the PAENDU, that is the Pan-African Epidemiology Network on Drug Use. Basically, as I initially stated, we all know across the globe, it's a transnational organized crime when it comes to issues on drugs and related activities. And Africa is not an exemption. The continent has been used for the transiting of drugs, especially from South America to the Europe or the America. But in the past, it was very difficult for us to get a clear picture of what was happening because we are not having evidence-based data. And this is where we felt that the PAENDU was very essential because the establishment of the PAENDU gave us to have a framework that we're using to collect data, but not only to collect data, but also to be able to network with our partners across the continent so that we can be able to understand the trend and know what is happening within other countries as well. At the national level, it was very essential because we had a team from the African Union that came to the Gambia to conduct an assessment. And during this period, it was easier for them to bring all the players from the Ministry of Health, as we all know that it's very important. Drugs do not exist in isolation, and you cannot curb them in isolation. So the coming of the team to the country allowed us to bring partners from the Ministry of Health, CSO, different stakeholders within law enforcement, and even some of the other religious groups that were involved to be able to have data that we can use to supply to the Paendu. At the continental level, it also enabled partners from different countries, from both health and law enforcement, to come together, network, and be exposed to evidence-based practices, share experiences, and then to be able to understand what is happening within different other parts of the continent. An example of this could be recently when we had the first supply suppression experts meeting, thanks to Dr. Akinola for such an initiative. We were able to notice a trend that most of the time, while we are focused on the seaport and the airport and land borders, we are now noticing a shifting in trend of use of postal services to be trafficking drugs, sometimes from the Europe, the America, and even other African countries. So definitely, as a testimony, we believe that the launch of the Paendu and the work of the Paendu has been very important to us in terms of us implementing a balanced, integrated, multi-sectorial approach between demand reduction, supply suppression, as well as international cooperation. Because it has not only helped us to network formally, but also for us to be able to network informally. Because during these meetings, we share information, we share contacts, and we are able to contact our partners in different other countries. So hence I have only 3 minutes that was given to me for to give a testimony. All what I can say is that the Paendu has been very essential. It has been essential in terms of giving us opportunity to gather evidence-based data that will guide our policies. Because if we don't have the correct information, the policies and the interventions that you could bring in will not actually address the problem. So definitely on that note, we thank the African Union, we thank the INL because they've been very essential, and especially Bill, because again, some of the benefit from this network again is we were able to meet partners from the INL, and I'm glad to say the INL funded a year-long universal treatment curriculum program for the Gambia. And the selection of our partners who participated in that was very interesting because we had representatives from the health, psychiatric nurses, we had from law enforcement, especially those who were rendering service to our gender, children, and human rights unit. We had 2 reform addicts. One of them is a journalist by profession, and the other one runs a CSO. And then we also have religious leaders because we have people who do faith-based treatment. But is it on evidence-based? Is it scientifically informed? So we had to bring them on board. We had the representative from the Department of Social Welfare. So in essence, it has not only helped us gather data, share experience, but it has also been an opportunity for us to network and then be able to bring evidence-based treatment services into our country. Thank you very much.
Just a quick background. So the International Narcotics Control Board, which is where the GRIDS program operates under, is a United Nations treaty body. So it's a separate entity from other United Nations bodies and offices. Through the guidance of the board, we have been able to do direct dialogue engagement with member states, primarily to monitor and assess national and international drug control efforts to ensure adequacy of drugs and precursor chemicals, but also to operate a number of special operational projects that identify diversion or trafficking and look to dismantle the sources of those. So the project that I work under is GRIDS, which is a global project. And what I'm going to talk a little bit about is some of the work that we're doing on the targeting tools, in particular what we're doing in the internet sphere. So primarily the focus of GRIDS is to engage both public sector, so this is your law enforcement, your border forces, customs, postal inspectors, train them up and give them access to targeting tools for the law enforcement side. Similarly, we have been engaging over the last, 15 years or so, the private sector, primarily in the chemical manufacturer side, But over the last 5 years on the online marketing side, the movement of goods side and the monetization. So think of that as a cycle from the manufacture of synthetic drugs utilizing precursor chemicals and equipment through the marketing of those substances online, which is generally where most of that happens these days. So think about online marketplaces such as e-commerce, think Alibaba, think of your marketing structures such as your social media platforms, which will funnel folks to those marketplaces for sales. Think about your movement sector. So your express couriers are our primary partners, but we also work with air cargo freight forwarders as well. And then ultimately the monetization. So a number of these are really actioned in the internet area. And since 2018, we've held about 25 global and regional meetings with these partners in the private sector. And with them have developed hundreds of technical recommendations over the last couple of years, which has resulted in a number of practical guidance documents specifically aimed at increasing voluntary cooperation, building those private sector relationships as trusted partners with industry. So think, Meta, think Facebook, think Twitter, et cetera, has allowed us to do some things that are very unique in terms of our operational work. Specifically, we've got a number of tools. I'm going to talk specifically about SNOOP, which is our scanning of novel opioids on online platforms. And this tool that we've been using in-house for about 2 years actually detects emerging marketplaces in real time. So as bad guys establish drug markets in the open internet, this system helps us to flag in real time and help us to identify those specific bad actors so that we can then identify them across platforms. So in other words, from their online marketplace to their online sales place, and then get that information back to our private sector partners and our public sector partners simultaneously through the existing relationships that we've been building over the years. Now, we internally at INCB have been utilizing this platform for several years extremely effectively. It allows us to identify the vendors, the contact information necessary, as well as account information across their entire product line. So we can see not only chemicals, but we can also see equipment, we can see in-product drugs, and of course, the deadliest substances to which our private sector partners are extremely interested in countering. In other words, legitimate industry, legitimate social media, e-commerce, shipping companies, which we work with, don't want anything to do with drug traffickers. And so we get this information to both the industry, but also to the law enforcement focal points at the same time for action. So those intelligence packages that go out help us to deny and disrupt and ultimately dismantle synthetic drug traffickers at their source by removing their marketplaces, but also getting that intelligence from those marketplaces to law enforcement investigators so they can take action. And this is very actionable tool in real time. So it's not a hypothetical, it's something that we've actually been using in-house for the last couple of years. And we've also been training some folks on how to utilize this with hopes that someday this tool will be rolled out to everybody. And these are just some of the recent examples that we've been training both in the Pacific as well as in South Asia, as well as counterparts in Latin America. And on the left side, you can see this link chart. This is an actual target from an actual case that was provided to law enforcement, as well as to partners in private sector, identifying their entire marketplace, as well as everything necessary to identify how they're operating, where they're operating, and ultimately how they're actually exploiting the private sector. In other words, we tell the private sector through our relationships how they're actually getting around private sector's actions to prevent them from already abusing their social media or their online e-commerce platforms. And we've done this very successfully in terms of the law enforcement side with our Ionix platform, which many of you are probably familiar with from your law enforcement side. But ultimately, we've also been doing this with SNOOP for the last couple of years. And so since 2020, when we started utilizing this system in totality, we've identified and removed about 5,000 online marketplaces and gotten the information on those actors back to law enforcement focal points for action. So not only does it allow us to do law enforcement action, allow us to do a trusted private sector relationship action with our private sector focal points, but it also allows us to ultimately dismantle their entire marketplaces across the spectrum. It's a very powerful tool. We're hoping that in the future, we'll be able to roll that out to all of our law enforcement focal points who have access to Ionics through Ionics, so that they can utilize the system through their phone the same way that Ionics and Grids Intelligence currently do. We've built it in a way that makes scalability possible because we utilize already INCB's systems that are in place and have been used for the last couple of years. And so the idea here would be to build that out, expand it for more real-time intelligence exchange, get that to all of our law enforcement officers. It's about 1,400 officers who currently use Ionics, and then allow that to link across our Grids Intelligence targeting systems so that we can continue to scale up the kinds of interdictions that we've already seen over the last couple of years. So I think that is probably the big piece here in terms of how we have a tool that already is being used to do this. And really the proposal, or what we're looking to do, is scale that up to encompass more than just the most deadliest substances, but also allow access in the mobile platform that we already utilize at INCB.